Hi everybody. March is Myeloma Awareness Month. Let's get some information from Dr. Neema Bhatt, who studied in USA and helping in India for people by bringing the latest technology for diagnosis and treatment of myeloma. Good morning, doctor. First question for you is, lot of people know about blood cancer and many of them know about leukemia from movies. Are there any type of other blood cancers?
Yes, so blood cancers is a general terminology that has become a very scary term in the world at this point. But all blood cancers don't refer to only leukemia. There are totally three different types of blood cancers. Leukemia is one of them. It usually tends to be quite aggressive, especially acute leukemias, and require aggressive treatment or very heavy or intense treatment. The other two types of blood cancers, one is called lymphoma and the third one is called myeloma. So lymphoma is a blood cancer that involves the lymph nodes, which are mainly like these forts that are present usually in the neck, in the upper part of the shoulders, in the underarms, in the groin we call. So and sometimes also in the stomach. So lymphomas are blood cancers that involve overgrowth or increased growth of these lymph nodes. There is yet another type of blood cancer called myeloma, which we know for the last few years is a type of blood cancer that specifically involves a type of blood cells called plasma cells. Plasma cells are normally present in all of our body. It helps us make cells that fight off viral infections especially, and make antibodies that take care of viral infections. But when these plasma cells are affected by blood cancer or by cancer, that is when we call this disorder as multiple myeloma or myeloma. And so this is just about three types of blood cancers.
Is there a difference between myeloma and multiple myeloma?
Multiple myeloma is the same as myeloma, so it is actually a spectrum of diseases. It starts from what we call MGUS or monoclonal gammopathy of uncertain significance. It's a long term. Basically, some proteins that are always present go out of proportion. Some proteins become too much in excess. They're called light chains or these abnormal proteins. Now, why these abnormal proteins increasing level becomes concerning is starts getting deposited in various organs. It can deposit in the kidneys and cause kidney failure. These proteins can sometimes deposit in brain, liver, and cause different complications in these organs. So that is MGUS. Then there is another alteration of myeloma called smoldering myeloma, where patients may have mild drop in the hemoglobin. They may have slight abnormality in these proteins, but it doesn't really qualify for what we call multiple myeloma. So this is the stage that happens before myeloma, just like pre-diabetes, diabetes. Then we already spoke about multiple myeloma, which is a frank type of blood cancer that affects your bone marrow, which is the factory where your blood cells are produced. There is yet another type of condition called plasmacytoma, where these plasma cells, for some reasons in the blood, they are not increased in circulation, but they attack a particular bone usually, or they form a soft tissue swelling. They form like a tumor in different parts of the body. A lot of times we see that they are also attacking one particular bone. So that is also another variation, or it falls in the same spectrum of multiple myeloma, where plasma cells are not functioning normally, and they're usually produced in large numbers, or these proteins are altered. So all of these require a high degree of suspicion. Unless we are suspecting either smoldering myeloma or plasmacytoma or myeloma, these are not overt diseases that would make a patient very, very sick. They come with very sort of subtle symptoms or subtle findings, and requires a high degree of suspicion to look for these and confirm the diagnosis.
Who is most at risk for developing myeloma? Are there any warning signs?
There is no at-risk population as such. Usually individuals who develop myeloma are at least above the age of 45, 50 years of age. But recently we have, with a higher degree of suspicion, we have found younger individuals. The youngest patient I have treated for myeloma was 39. As far as the warning signs go, there, as I mentioned, they're very subtle or very sort of faint symptoms. It can be just fatigue, so feeling a little more tired than your usual self, not feeling like doing all your activities, especially by the end of the day, feeling very lethargic, having bony pains. Especially in advanced diseases, we find that these myeloma patients have a lot of punched out lytic lesions in their bones. So having pains in the ribs, having pains in the shoulder, hip or leg. So all these are non-specific symptoms, but but they definitely can cause these faint symptoms. Apart from that, of course, advanced myeloma, where the disease has been present for some time, these patients present with renal failure. So we'll find that kidney parameters are abnormal. Sometimes there is presence of low back pain. That is actually one of the most common presenting symptoms, apart from fatigue or tiredness, having persistent or continuous low back pain. And when we do an MRI or CT to see what the back pain is because of, we find these lytic lesions or these lesions where the bone has basically been eaten by the plasma cells. So those are mostly your warning signs for myeloma. Doesn't cause fevers usually, also does not cause significant weight loss, although if the disease has been present for quite some time, patient might have weight loss and reduced appetite as well.